NDP MLA Meara Conway making her way across the province, touring the rural healthcare facilities, hoping to highlight service closures. We have her in studio with us this morning and talk about this a little bit more. And of course, we'll talk to the health minister tomorrow at the same time on this program. Meara, thank you for doing this. Welcome to the set.
Thank you.
Where did you start and what precipitated this tour?
Yeah, so we kicked it off early last week in North Battleford, which happens to be the constituency of the Minister of Health. We've been in many communities so far: Shellbrook, Yorkton, Prince Albert, Moose Jaw, Fort Capel. We're off to Kindersley, Meadow Lake, Swift Current, and others this week. We are trying to shine a light on these serviced closures. We feel that it's very important for people to get access to healthcare where and when they need it. We've come into some data that shows that since the summer of 2019, ERs have been closed nearly 4,000 days in Saskatchewan. Maternity wards, close to 500. Pretty significant problem, and one that's only getting worse is what we're hearing.
Where did that data come from?
Freedom of information request, yeah, okay, that we obtained, yeah.
And when you go to these communities, what are you hearing from healthcare workers directly?
There's a deep sort of frustration. There's an eagerness to engage. People have ideas. People are worried that it's going to get worse. One of the things that we're concerned about is this year's budget, which saw a reduction in healthcare funding. When you look at what they're budgeting to spend this year and what they spent last year on healthcare, there's a difference of 17 million there. This is not a time to be cutting healthcare. This is a time to be investing. Frontline healthcare workers, physicians, nurses, they're all kind of singing from the same playbook. They are concerned, very concerned, but they have ideas, and they want this government to engage.
No, Jeremy's going to be here tomorrow on set, and he's going to argue that they are allocating money, that they are putting resources towards healthcare to where they feel they need it and where they've heard they need it. So what's your response to that?
Well, I think when we look at the budget, it's there on page 57. They are cutting healthcare. When you think of nurses, they've been asking for a task force for years. We saw the government finally agree to that in the 11th hour of this past provincial election. That's been slow to get off the ground. Frontline healthcare workers just rallying outside the ledge earlier this week without a contract, without a pay raise. So when we think of the healthcare across the country and the fact that we have to be very competitive in Saskatchewan to recruit and retain healthcare workers, I don't think we're doing nearly enough to build up capacity and to keep people here at home.
You're touring and you're listening. What do you do with the information?
We push the government as opposition, and then ideally we propose alternatives, and we.
Have you come up with any already?
Yes, I mean, we've been very clear that this task force should have happened a long time ago. There are solutions around, we often post part-time positions, not full-time positions. We believe that there's lots of reform that could be happening in primary care, which of course is driving a lot of these issues. We have no shortage of solutions, but I think the most important thing is that frontline healthcare workers do have ideas. I've been on the phone, I've been on the horn for weeks, just kind of talking to healthcare workers. They are so eager to engage. Physicians have ideas about models, coverage, how to bring back more balance to their lives. Frontline healthcare workers have put out reports. We hosted them in the legislature just weeks ago. Short, medium, long-term solutions. All of those solutions that they outlined there are in our view sound. So there are lots of solutions that we've been trying to talk about, we'll continue to talk about, because it's very important.
Well, we'll get you off set and back on your tour. Thank you for doing this.
Thank you, Daryl. Thanks for having me.